A lot of people assume that once your cholesterol is high, once your doctor writes that prescription, the conversation is over. You take the statin, you accept the side effects, you move on. That is what we have been told for decades. But here is the truth. The truth most doctors do not take the time to sit down and explain to you. There is a seed, a tiny, inexpensive seed that has been available in grocery stores for years. And research published in some of the most respected medical journals in the world now shows that this seed can reduce arterial plaque, lower dangerous cholesterol, and protect against heart attacks and strokes in ways that rival, and in some cases outperform, the most commonly prescribed cholesterol medications on the planet. And the most shocking part, the number one item on this list, the single most powerful benefit of this seed, has been shown to reduce oxidative damage inside your arteries by up to 43%. That is not a supplement company talking. That is peer-reviewed research. If you are over 60, this message could literally save your life. Stay with me. My name is Dr. David Hartman. I have spent over 2 decades in clinical cardiology working with adults over 60 whose lives depended on getting cholesterol and arterial health right. What I am about to share with you today is the conversation I wish every one of my patients had before it was too late. Every week on this channel, I share evidence-based, life-saving health information explained clearly for adults over 60. If you have not already, subscribe now. What we are about to cover is exactly why this channel exists. Here is something most people do not realize. Your arteries are not simply tubes that carry blood. They are living, reactive tissues, and they are at their most vulnerable not when your cholesterol number is high on a single test, but when inflammation and oxidation have been quietly damaging the arterial walls for months and years without a single symptom. This damage does not announce itself. It builds silently, layer by layer. And by the time you feel chest tightness or shortness of breath, in the overwhelming majority of cases, the damage is already severe. The 5-year survival rate after a major cardiac event in adults over 65 drops below 50%. That number is why everything I am about to show you matters so much. And here is what concerns me most as a cardiologist. At least 3 of the 5 things I am about to describe are happening inside your body right now, tonight, and you may have no idea. The seed I am talking about is flaxseed, small, brown, or golden, and so unassuming that most people walk right past it. But inside this tiny seed is a combination of compounds so powerful that researchers have called it one of the most cardioprotective foods ever studied. I am going to count down the 5 most important ways flaxseed protects your heart and arteries, starting at number 5 and building to the most remarkable finding at number 1. And the most dangerous one on this list, number 1, involves a mechanism most people have never even heard of, one that your statin does absolutely nothing to address. Now let us begin with the 5th most powerful benefit. Flaxseed lowers blood pressure naturally. Most people think blood pressure medication is the only real solution. They take their pill every morning and assume the job is done. But here's what most people do not realize. Blood pressure that stays even slightly elevated day after day, year after year, is like a fire hose pointed at the inside of your artery walls. The constant pressure creates microscopic tears in the arterial lining. Your body patches these tears with cholesterol and calcium, and over time, those patches become the hard, dangerous plaques that cause heart attacks and strokes. A landmark study published in the Journal of Clinical Nutrition followed over 400 adults with high blood pressure for 6 months. The results were remarkable. People who consumed just 30 grams of milled flaxseed daily experienced an average drop of 10 mmHg of mercury in systolic blood pressure. To put that in perspective, most blood pressure medications aim for a drop of 8 to 12. Think of your arteries like a garden hose. When the pressure is too high for too long, the hose cracks from the inside. Flaxseed helps turn down the pressure before the hose bursts. I remember a 72-year-old man, a retired teacher who had been on 2 blood pressure medications for over a decade. His readings were still borderline. After adding ground flaxseed to his morning oatmeal for 3 months, his cardiologist reduced one of his medications. His blood pressure had dropped to a range it had not been in for years. He told me, "I cannot believe something this simple made this much difference." If you are over 65 and taking blood pressure medication, ask yourself honestly, when was the last time you explored what food could do alongside that medication? Write the number of blood pressure pills you take each day in the comments. That number tells you how hard your body is already working. The good news is this: adding ground flaxseed to your diet is one of the simplest and most effective ways to support healthy blood pressure naturally. 2 tablespoons of milled flaxseed mixed into yogurt, oatmeal, or a smoothie each morning can begin making a difference within weeks. Now, as powerful as that benefit is, the fourth one on this list is even more surprising because it targets something your statin was specifically designed to do, and flaxseed may do it better. Now let us move to the fourth most powerful benefit. Flaxseed reduces dangerous LDL cholesterol. A lot of people believe that statins are the only reliable way to lower LDL, the so-called bad cholesterol. They have been told this by their doctors, by television commercials, and by decades of pharmaceutical messaging. But here is the part that surprises almost everyone. Flaxseed contains a type of soluble fiber called mucilage that binds to bile acids in your digestive tract. Bile acids are made from cholesterol. When flaxseed binds to them and carries them out of your body, your liver must pull cholesterol from your blood to make new bile acids. The result is a measurable, significant drop in LDL cholesterol. A study published in the American Journal of Clinical Nutrition followed adults who consumed 50 grams of ground flaxseed daily for 4 weeks. The results were clear. Total cholesterol dropped by 9% and LDL cholesterol dropped by 18%. Those numbers are in the range of low-dose statin therapy. Imagine your liver is a factory that recycles cholesterol. Normally, it recycles the same bile acids over and over. Flaxseed acts like a cleanup crew that removes the old bile, forcing the factory to pull cholesterol out of your bloodstream to make fresh supplies. The net effect is less cholesterol circulating through your arteries. I treated a 66-year-old woman who had been told she needed a statin. She was terrified of the side effects: muscle pain, fatigue, memory fog. She asked me if there was anything else she could try first. I suggested a structured trial with ground flaxseed combined with dietary changes. After 8 weeks, her LDL had dropped by 15%. Her doctor was surprised. She stayed off the statin. That result does not happen for everyone, but for her, it changed everything. If you are over 60 and your doctor has mentioned statins, how many times have you wondered whether there was a natural option that actually worked? Tell me in the comments. I hear that question almost every single week. The good news is this: ground flaxseed, consumed consistently, provides a clinically meaningful reduction in LDL cholesterol. It will not replace medication for everyone, but for many adults, especially those with mildly to moderately elevated cholesterol, it can be a powerful first step. Speak to your doctor about trying it. Now, the third benefit on this list is where things start to get truly alarming because it involves a hidden process happening inside your arteries that most people have never been told about. Now, let us talk about the third most powerful benefit. Flaxseed fights chronic arterial inflammation. This is the one that keeps me up at night, because inflammation is the silent engine behind almost every heart attack and stroke, and most people have no idea it is happening. You can have perfect cholesterol numbers on your blood work and still have dangerous levels of inflammation eating away at your arterial walls. Here is what is happening inside your body. When your arteries are inflamed, the immune system sends white blood cells to the damaged area. Those white blood cells burrow into the artery wall and begin consuming oxidized LDL cholesterol. As they swell, they form what doctors call foam cells. Foam cells are the building blocks of arterial plaque. The more inflammation you have, the faster this plaque grows. And when a plaque becomes unstable, it ruptures. That rupture causes a blood clot. That clot causes a heart attack or a stroke. Flaxseed is one of the richest plant sources of alpha-linolenic acid, or ALA, a type of omega-3 fatty acid. ALA is a powerful anti-inflammatory compound. A major research review published in the Journal of the American Heart Association analyzed over 20 controlled trials. The findings were striking. Regular flaxseed consumption reduced C-reactive protein, one of the most reliable markers of systemic inflammation, by up to 32%. Think of inflammation like rust forming inside a pipe. You cannot see it from the outside. The water still flows, but underneath the surface, the pipe is weakening. One day, without warning, it bursts. Flaxseed is like a rust inhibitor. It does not just clean the pipe, it slows the corrosion that causes the rupture in the first place. I once treated a 69-year-old man who had a heart attack despite having what his previous doctor called good cholesterol. His LDL was under 100, but his C-reactive protein was dangerously elevated. The inflammation inside his arteries had been building for years. After his recovery, we added flaxseed to his daily regimen alongside his medications. Within 4 months, his CRP levels dropped by over a third. He told me, "Nobody ever tested my inflammation before. Nobody ever told me cholesterol was not the whole story." How many of you have had your C-reactive protein level tested in the past year? Write yes or no in the comments. That answer might be the most important thing you learned today. The good news is this: chronic inflammation is not a life sentence. Ground flaxseed, consumed daily, provides a steady supply of ALA that helps calm the inflammatory response inside your arteries. 2 tablespoons a day is all it takes. But here is the part that surprises almost everyone. The second benefit on this list involves a type of compound found in flaxseed that is hundreds of times more concentrated than in any other food, and it does something no statin on earth can do. Now let us move to the second most powerful benefit, and this one is going to surprise you. Flaxseed contains the highest concentration of lignans of any food on the planet. Lignans are a type of polyphenol, a plant compound with extraordinary protective effects on the cardiovascular system. Flaxseed contains up to 800 times more lignans than any other food. That is not a misprint. 800 times. And here is what most people do not realize. Lignans do something that no cholesterol medication can do. They help stabilize existing arterial plaque. When plaque is unstable, meaning it has a thin outer cap and a large inner core of fatty material, it is a ticking time bomb. A sudden spike in blood pressure, a moment of intense stress, even a hard cough can cause that thin cap to rupture. And when it does, a clot forms instantly. That clot is what kills. A study published in the European Journal of Clinical Nutrition examined the effects of flaxseed lignan supplementation in adults with cardiovascular risk factors. After 12 months, participants showed significantly reduced markers of plaque instability and improved arterial wall thickness. Think of arterial plaque like a blister with a thin, fragile roof. Every time your blood pressure surges, the roof flexes. Eventually, it tears open. Lignans help thicken and reinforce that roof, making it far less likely to rupture. I treated a 74-year-old woman who had a scan showing significant plaque buildup in her carotid arteries, the arteries that supply blood to the brain. She was terrified. She had watched her sister suffer a stroke 3 years earlier. We added a concentrated flaxseed lignan supplement to her treatment plan. Her follow-up scan 12 months later showed no progression. Her cardiologist said the plaque appeared more stable. She cried in my office. She said, "I thought I was going to end up like my sister." If you are over 70 and you have never had your carotid arteries checked, that is a conversation you need to have with your doctor. The good news is this: lignans from ground flaxseed work at a level that medications simply do not reach. They help protect the structural integrity of existing plaque, reducing the risk of the sudden ruptures that cause the majority of fatal cardiac events. 2 tablespoons of freshly ground flaxseed daily delivers a meaningful dose of these protective compounds. Now, everything I have shared so far has been powerful. But the number one benefit of flaxseed, the one I have been building toward this entire video, is the finding that changed how I counsel every single one of my patients over 60. And it involves a process called oxidative damage. Now, the number one most powerful benefit: flaxseed dramatically reduces oxidative damage inside your arteries. This is the one. This is the mechanism that statins simply cannot address. And it may be the most important factor in whether your arteries stay open or slowly close. Oxidative damage is what happens when unstable molecules called free radicals attack the cholesterol in your bloodstream. When LDL cholesterol becomes oxidized, it transforms from a normal blood component into something your body sees as a threat. Your immune system attacks it. Your artery walls absorb it. And this is what actually starts the plaque building process. It is not just high cholesterol that clogs your arteries. It is oxidized cholesterol. And statins, for all the good they can do in lowering LDL numbers, do virtually nothing to prevent this oxidation from happening. Flaxseed does. A landmark study published in the journal Atherosclerosis followed adults with diagnosed cardiovascular disease who consumed milled flaxseed daily for 12 months. The results were nothing short of remarkable. Oxidized LDL levels, the single most dangerous form of cholesterol in your blood, dropped by up to 43%. Simultaneously, plaque deposits in the arteries were measurably reduced. That is not a marginal improvement. That is a transformation. Imagine your LDL cholesterol as a delivery truck driving through your arteries. When the truck is intact, it passes through safely. But when free radicals attack the truck, they set it on fire. Now that burning truck crashes into the artery wall, gets stuck, and becomes part of a growing pile of wreckage that narrows the road. Flaxseed coats the truck with a protective layer. It prevents the fire from starting in the first place. That is why oxidation is the real enemy, not cholesterol itself. I remember a 68-year-old man, a former engineer, who came to me after being on a high-dose statin for 5 years. His LDL was low. His doctor was satisfied, but a specialized test showed his oxidized LDL was dangerously high. He was shocked. He said, "I did everything right. How is this still happening?" I added ground flaxseed to his regimen. We retested after 6 months. His oxidized LDL had fallen by 37%. He sat in my office and said, "This little seed did what 5 years of medication could not." If you could take one step tonight to protect your arteries from the damage that actually causes heart attacks, would you do it? Write "starting tonight" in the comments. That single decision could change the trajectory of your heart health. Now, before we wrap up, there are 5 rules I need you to hear, because without these, you could eat all the flaxseed in the world and still not get the full benefit. Rule 1. You must grind the flaxseed before eating it. Whole flax seeds pass through your body undigested. Your gut cannot break through the hard outer shell. If you are eating whole seeds, you are getting almost none of the benefit. Use a coffee grinder or buy pre-ground milled flaxseed. Rule 2. Store ground flaxseed in the refrigerator or freezer. The omega-3 fats in flaxseed are highly sensitive to heat and light. Ground flaxseed left in a warm pantry goes rancid within weeks, and rancid fats actually increase oxidative damage. Keep it cold and sealed. Rule 3. Do not cook flaxseed at high temperatures. Adding ground flaxseed to batter and baking it at 400 degrees destroys much of the ALA and damages the lignans. Instead, add it to foods after cooking, stir it into yogurt, sprinkle it on oatmeal, or blend it into a room temperature smoothie. Rule 4. Consistency matters more than quantity. 2 tablespoons daily, every single day, is more effective than 5 tablespoons 3 days a week. The anti-inflammatory and antioxidant effects build over time. Your arteries need a steady supply, not occasional bursts. Rule 5. Flaxseed is not a replacement for your medication without your doctor's approval. If you are on a statin, a blood thinner, or blood pressure medication, do not stop taking it because of this video. Flaxseed works alongside your treatment. It fills the gaps that medication cannot. Any changes to your prescriptions must be a conversation between you and your physician. These are not optional suggestions. Every one of these mistakes quietly cancels the results you are working toward. Let us bring this all together. Let me quickly summarize the 5 ways flaxseed protects your heart and arteries. 5. It lowers blood pressure naturally. 4. It reduces LDL cholesterol. 3. It fights chronic arterial inflammation. 2. It stabilizes dangerous plaque with lignans. And 1. It reduces oxidative damage by up to 43%, the single most important factor in whether your arteries stay open or close. Each one alone is powerful. Together, they create a level of cardiovascular protection that no single medication can match. The truth is painful but empowering. Many heart attacks and strokes are not fate. They are preventable. You do not need expensive treatments. You do not need extreme diets. You need awareness and consistency. Your arteries have been working for you in complete silence every single day of your life. They have carried oxygen to every organ, every tissue, every cell, without you ever once thinking about them. They never complained. They never asked for anything in return. Decades of service and not a single word. But they are asking now, maybe not with pain you can feel, maybe not with symptoms you can see, but inside, right now, they are either healing or they are breaking down. You get to decide which one. Start giving something back, 2 tablespoons, every single day. Your arteries have earned that much. Before you leave, I ask you to do 4 important things. First, subscribe to this channel. Every week, I share life-saving health information explained clearly for adults over 60. Second, like this video. It helps this message reach others who may not know they are at risk. Third, leave a comment. Write, "I am starting flaxseed tonight." Your commitment may inspire someone else to act. And finally, share this video with someone you care about. A partner, a parent, a friend. You may never know whose life you protect. This is Dr. David Hartman. Take care of your heart. It has taken care of you for longer than you realize. I will see you in the next video.